Welcome to Intentionalist again. My name is Coach Alice Mohirwa. I'm your host. This is Intentionalist podcast. In this episode, we are going to discuss hormone therapy replacement. We are in a season where we are discussing a woman rebuilding back her power. And one of the things that really boost us, give us longevity, cognition, power as women are our hormones. In today's episode, we are going to discuss how can we boost, how can we maintain, how can we replace so that we can keep at par with our cognitive sense and with our reproduction system functional. Today's guest is an amazing woman. She has been in this particular industry of hormone replacement therapy for over 20 years. Dr. Linda has worked with Aga Khan and she also practiced in a private clinic. She's going to tell us more about hormone replacement therapy, what it is, the best candidates, what to look at, how to carry yourself, the self-care within perimenopause, menopause, and post-menopause. She's the right candidate to give us the right insight that you need to look up to if you know you want to depart on this journey. We are going to really demystify a lot of things. We are going to discuss what you need to be very keen on so that this has become an enjoyable journey of your perimenopause and menopause care. So welcome. Grab your tea so that we have this conversation. Welcome on board, Dr. Linda.
Thank you so much, Alice. It's a real pleasure to be here. It's a real pleasure to be with everybody out there. It's something that I was actually very excited about last night. I could hardly contain myself to come and just help women demystify, as you said, and how to understand what they need to do and how they should do it and where they can get the help. And to be honest, not everybody would want hormone replacement therapy necessarily, but at least if you have the choice and you understand about it, it's your decision to make. Sometimes there are those that really do need it and they will be the ones that will, if you like, be really good candidates for it. For other people, it's a bit of a choice, and for some people, they would rather go the more natural way, which is fine too.
I would like to start by that. What is hormone replacement therapy?
Okay, so as you get older, and older being over 40 usually, and 50 and 60, etc., your hormones naturally as you age reduce. So that's your estrogen, your progesterone, and your testosterone. And as you age and those hormones drop, you get symptoms related to them because they're very constitutional in us. So every single part of your body will have estrogen receptors, progesterone, and testosterone. The thing our body craves most when we get older is the estrogen. It affects all sorts of your body, including your head, your mind, your skin, your gastrointestinal system, your genitourinary system, your muscles, your bones, like just about every single organ in your body is affected.
What age bracket are we talking about?
So when you go into your 40s and 50s, now a lot of it's genetic as well. So it really depends on when your mum, for instance, went through menopause. Some people go through menopause or perimenopause. They start it very early. So you can get people who are maybe in their late 30s actually starting perimenopausal symptoms without even knowing, because you don't think you're old enough really then. So perimenopause can last up to 12 years. So if your natural menopause or the standard age, if you like, is 51, then you could be, when you're 38, you're starting to 39, you're starting to dip in all your hormones. So it's actually a lot earlier than we think. And as we know, the 40s are very challenging anyway. So now you add in your hormones and you've got teenagers at home and you've got elderly families and a career that's hopefully rocketing. You find yourself really in quite some hazard.
And what are the common particular symptoms that women experience in this kind of age bracket?
So, to be honest, whenever people think about HRT or hormone replacement or menopause or perimenopause, they think of only one thing, and that's usually hot flashes, night sweats, and that's about it. But actually, when you look at the literature, it's more usually commonly affecting the brain. So it's more the anxiety, the insomnia that comes with that, and things like panic attacks that you've never had, the inability to cope, the low mood. You know, women really feel, and I see it in clinic, really feel like they've lost who they were.
Yes.
And they don't know how or why. And they think nothing's really changed, but something's changed, and they're not sure how. So you get women who are high flyers, maybe in their early 50s, they're in high-end jobs, and they suddenly can't manage.
Yes.
In fact, I had one lady that said, I have to retire. And I was like, what?
Is that why women in their mid-40s get so irritable and sometimes even resign from their job because they can't take it too much?
Exactly that. Yeah. I mean, there's a lot of intertwining things going on there. It's also the time, to be honest, where women find their own love relationships start to fall apart. So we don't know how much of that is due to changes in hormones, changes in women's situations.
I think also the ability probably to cope with stressors and it's
irritability.
A lot on one plate.
Yeah.
I think so.
Yeah.
And what exactly hormone replacement therapy available in Kenya?
So, you know, to be honest, about 5 years ago, really, it was a difficult one to find. You could find what we call the synthetic hormones. So
synthetic hormones.
Synthetic ones, the ones that are manufactured, such as Premarin, which we know is made out of horse urine. And then there was a synthetic progesterone, such as things called Provera. Now, those were available, but obviously there was a lot of worry about taking those. So I'm sure we're going to come to that.
Yes.
So those were available. Now, we're quite lucky in that we've got the newer versions available. Now, unfortunately, they are quite expensive, but they are now here in Kenya. So you are able to get the estrogels and the utrogestin, which are all body identical, which basically means that they're very similar to our own body's hormones. So you're not putting something synthetic, but you're putting something that your body already has.
Will absorb it.
Yeah, it's a bit like when you have a hypothyroid and you take thyroxine.
Yes.
It's the same kind of thing. So if you look at menopause as hormone deficiency rather than this kind of real mystery, then you understand a little bit more about the management and what we can do to help.
How does that journey looks like when I just want to embark on hormone therapy replacement?
So usually some people do come in and say, I've had enough, my friend's on this and she says it's magic, I want what she's got because she says it's great. And actually quite a lot of the consultations I get come through other people's referrals. But sometimes, to be honest, somebody will come in with something else, maybe a burnout or an inability to cope or something more mental health orientated. And then they may not realize that it's perimenopause. So then we discuss it. And usually I get people to fill out a questionnaire so that we can look at which symptoms that they have. And then we base the management and things around that. It's not that I always start people on hormone replacement therapy. Yeah.
I remember in that movie of M Factor, a lady was confessing that she was put for a very long time on antidepressant, and it was just perimenopause. And when she was put on HRT, it was fixed itself. She never had any of panic attack, anxiety, and all of that.
Yeah,
so I mean, do you collaborate with psychiatrists, or how do you assess and decide that this is something that has nothing to do with mental health?
So it's an interesting one. I, as a family doctor or family physician, I do a lot of mental health anyway on the side.
Yes.
So I do see patients who have anxiety and depression aside from this. And I always now, I didn't used to probably about 10 years ago, ask myself, you know, could this be more perimenopause? And then you look at the history and see, have they had mental health issues before this time of their life? Has anyone else in the family got mental health issues?
Yes.
And so you look at the whole person and what else could be going on, because sometimes there are other factors going on in their life that you can't manage.
Yes.
You know, maybe somebody's going through relationship issues or work issues, you know, that you look at that. And quite often it's one of those things that sometimes they come with antidepressants already and they're not working.
Yeah.
So you end up ramping them up. And actually, with those sort of people, if I'm looking at why they're not responding, I might then add in the hormone replacement therapy alongside and see if we can reduce the antidepressant therapy, because obviously you wouldn't want to just whip away the antidepressant therapy. So you try and manage that. Most people, I'd say, look, let's try the hormone replacement therapy. You might need some antidepressants as well. So it really depends to help, because anxiety is a big thing with perimenopausal and menopausal women.
Yes, very true. How soon should a woman start considering a hormone therapy replacement?
So it's an interesting question. There isn't a right or wrong answer. There's like one of those that you take each individual as it is. There's different schools of thought. So when you read the literature, it's a little bit confusing about what's right and what's wrong. And so there's always a little bit of toing and froing. So I think you go with what feels right for you and the doctor that you're seeing. Sometimes when I see somebody who's got really bad symptoms. Now, if you look at the population, 100% of women are going to go through menopause of this age, if you make it that far, God willing. Out of those, 75% will have symptoms. Out of the 75%, 25% will have really life-changing symptoms that really upset their whole world. So those 25%, it's really what I'd say is a no-brainer if they don't have any issues medically to take hormone replacement therapy, because it really puts people back on track, and I've seen it quite often. Then the ones which are kind of in between, it becomes a bit of a choice. Now, in regards to benefits to individuals, again, it's a little bit different in some of the literature. But if you take HRT within the first 10 years of menopause being when you're a year after your period has stopped, you get the benefits such as your bone health. It's actually got an 8% decrease in mortality, which when you think about that, you're like, why are we not all on it? You know, but that's not as simple as always. So you have to be careful about facts and figures and understanding about that. So the answer is between the doctor and the patient and what the symptoms are like. So I always find the 25% which don't have symptoms are the ones very happy to go ahead and not take HRT and say that, why don't you just, you know, do it naturally? But those that 25% that have really bad symptoms, it's not, I don't think, personally, it's not a choice. It's, you should take it. Those in-betweeny bits, then you educate yourself and then you make a choice. I mean, I am on HRT. So it's not that everybody should be, and I say to patients, I'm very pro HRT. I think that as a woman, when you're spending 30% of your life being hormone deficient, why would you not give yourself that boost? You know, and also it's not just the brain, or it's the whole body. You know, your vaginal health, which I know you'll come to, you know, will age. You know, your libido goes out the window because of all sorts of reasons, maybe the anxiety and things like that, and also just the hormones dropping. And also it's painful if you've got dryness in the vagina, which is a symptom. So
I would like us to go through that among the other risk that a woman who is in high deficiency of hormones, what are the other major risks that a woman who is in high deficiency of hormones is more likely to experience?
So apart from obviously the mental health risks and stuff, you know, they're more at risk of things like osteoporosis. They're more at risk of cardiovascular disease. So HRT is actually decreasing their risk of that. They're also more at risk of things like diabetes. If you think about what happens to our bodies as a woman, when you go into your 40s and 50s, your body also ages. Like even for men that happens, that their muscle reduces. As you age, your muscle reduces. So as your muscle reduces, your ability to burn fat reduces. So therefore you put weight on much easier. So when you're 20s and 30s, when you're cruising with a perfect body, eating junk, not working out, whatever, you suddenly find in your 40s and 50s, you're living with the reality. Like this middle-aged spread, or, you know, and it's a big thing. So
inflammation.
And with that comes extra risk, you know, such like I said, diabetes and things. So, and all the cancers are related also to the risk of, you know, if you're obese or overweight, or, you know, carrying too much, not exercising enough.
I'm very curious to know, how does a woman who lives with PCOS, probably you are diagnosed in your at the age 20s, 30s. What would you advise? Is it a good way to contribute into healing and balancing your imbalance when it comes to hormones?
Now, that's an interesting question because obviously PCOS is mainly to do with your reproductive systems when you're ovulating and things like that. So if you look at the main management for PCOS, it's actually the oral contraceptive pill because it levels out all your hormones.
Yes.
The biggest contributing factor to symptoms of PCOS is actually weight gain.
Yes.
So if you put weight on, because the adipose tissue, or the fat tissue, if you like, causes resistance to insulin and also increases your actual estrogen available.
Yes.
So when you go into menopause, the PCOS isn't such a big issue. And it's not something that you're going to manage just because you've got PCOS as you go into menopause. It's more of a thing that you would manage when you're in your reproductive cycle.
When you're in hormone therapy and you are on PCOS treatments, are those going to merge or one will replace the other?
When you hit 50, basically, you shouldn't be on the oral contraceptive pill anymore. You should be on hormone replacement therapy. Now, as your normal hormones settle down and they decline, you don't have such big drives in the PCOS because a lot of the PCOS is around the cycling every month.
Yes.
So the symptoms that patients feel with PCOS really is things like the acne and the hirsutism. So you probably, I would treat alongside hormone replacement therapy if they're of that age. To give them something to help the acne and things like that, which would be what we'd call anti-androgenic, which is anti the kind of male side of the hormones, so to speak, because that's what they produce more of. And it's it's a complex issue, PCOS, but it's mainly to do, like I said, with your reproductive organs. So when reproductive cycle, which is, when you go through menstruation straight away, and then you spend 20 years, 25 years in, that arena, and then you go out the other side. So PCOS is less of an issue when you go into menopause, but it doesn't mean that they shouldn't have hormone replacement therapy. The people that we worry more about, if you like, are those with things like endometriosis.
Yes.
People with endometriosis might have bits of the uterus, if you like, the lining, which is outside of the uterus, which if you aren't careful, you can encourage it to become active when actually when you go through menopause, that's when it should all settle down. So you have to be careful with that. So people shouldn't really be going to get hormones without seeing a doctor.
Yes.
Which in our country, sometimes people can get what they want, when they want and how they want. So you have to be careful.
Are you listening? It's important. Now, there is something you mentioned that really took my attention. You say that this journey of perimenopause, it's almost over a decade. What does it look like for a woman who is rebuilding herself, rebuilding her power, rebuilding her cognitive sense, rebuilding her sexual drive? Because when we are in our 40s, people say life starts at 40. And
Amen.
Honestly, when I look at my personal journey and many other women that I talk to, I think the body disrupt more in your 40s. That's when you find so many things conflicting among themselves within the body. And how do we channel this? And probably that's when women are also recommitting to new relationships, finding themselves, wanting to enjoy sex more, wanting to express themselves sexually, wanting to go more sensual. And yet there is no that sex drive that is supposed to come like when you're in your 30s. How can we explain that vis-a-vis to our hormone status in that 12 years journey? Why is that a woman in late her 40s, her sex drive drop? And how can we correct that?
So that's one of the symptoms of menopause, obviously, or perimenopause, is that your libido reduces because of the lack of hormones, most specifically estrogen. But there is this other hormone called testosterone, which also has something to do with our libido. So some women don't have any issues with their libido, but there are those people that do. And some of the libido issues may actually be because they've got a dry vagina, and that it's painful to have sex because they don't lubricate like they do. Even though they have the desire, it doesn't seem to work as well. And as much as we like to use lubrication and things, that might not be enough. So the great news is that, hormones really help. And the first one to use would be the estrogen. And if you've got a womb, you always have to have the progesterone component of it. So you can't just go and buy your HRT estrogen only and use that, because you'll end up with issues in your endometrium, because your endometrium then will have what we call unopposed estrogen, and it thickens up. And that leads to irregular bleeding, and it's a risk factor for endometrial carcinoma. So,
ladies, don't self-medicate.
Yeah, please, don't self-medicate.
That leads me to ask you, Dr. Linda, how does a consultation for HRT looks like? When I come to your clinic, what should our listeners, what should they expect?
So obviously your doctor would take a nice history to find out what your actual issues are, in regards to, what symptoms you have, how bad are the symptoms, what do you want out of the whole HRT journey? A lot of people I speak to are like, when should I start HRT? When is the right time? I'm just like, you just don't know when the right time is. Sometimes there is an epiphany moment where you go, right, I've had enough. But I always encourage people, especially if they're at the beginning of the journey, you can do lots of other things, not just HRT. So you can eat healthily, and there's lots of plant-based estrogen or estrogen-based plants that you can enjoy, lentils and tofu, and there's some fruits, and there's quite a few. I'm not a dietitian, so I can't tell you exactly which ones to go, but Google is great with that. So you can supplement on the dietary side. You can also exercise. Exercise is a brilliant bit of, even if you're on HRT, to exercise, you should be doing that almost every day if you can, not for hours, but just some. Weight training is incredibly important as well for bone health. So ladies, 2 days a week, get out there and push some weights, please. So I always encourage that. There's also vitamins and supplements that people can use. So, and there's a whole dedicated market to that kind of side of things.
The better consult. So I will say that I know you are curious to know, after knowing what to go through and how to go for a consultation, how much?
How much money?
Yes. How much is a consultation? What can a patient expect to spend in the journey? Are they testing? How much could be like a starter budget? So like, there's always, this is Kenya, we can always negotiate, just put it out there. Consultation fee for someone like myself, for instance, is 4,000. And that's standard, whether you're coming to see me for gastrointestinal issues or menopause or a skin problem, it's standard. And then the literature, and I think it's very true, I've seen it a lot, it's not that helpful to spend lots of money on blood tests. So don't think that, automatically assume that blood tests are going to be the answer, because a lot of women in their perimenopause may have normal blood test. And it's very confusing then, and they're not cheap. So my advice would be, unless there's a really big reason to spend money on the blood test, which is usually if you find that your periods are absent under the age of 45 or 40, then it's worth looking. But if you're just looking to see, where are my hormones, it's pointless, because today they're this, tomorrow they're that, next week they're this. Fluctuate.
Because it goes like a seesaw. So save that money. Better you spend that money on treatment and medication.
We cannot end our conversation without demystify so many myths around HRT. Because 10 years ago, there were so many publications pushing women to go against it, different medical risk and all that. But recently, they were all demystified. Would you also take a chance to speak about that and tell our listeners really those are myths and why they are myths?
Back into, it's more than 20 years basically, or 25 years now. There was a big study that came out called the Women's Health Initiative Study. And unfortunately, it did a lot of damage for women. So the generation above us really struggled without hormone replacement therapy. And the reasons for that is they basically said that it increased your risk of heart attacks, and it increased your risks of breast cancer and clots.
Now,
the cardiovascular risk, that is totally demystified. It's not true.
Yeah.
In fact, it improves your
cardiovascular
and your mortality by
Yes.
8% if you take it. And they did that in a study between 50 and 64-year-olds. I think quite a lot of women in Europe.
Yes.
So unfortunately, we're still waiting for our studies, but we'll get there.
Yeah.
So risk of breast cancer is a big issue for some women. It's sometimes a risk you have to also take on yourself. You can't just expect a doctor to give you that answer. It's got to be worth it for you. So obviously, if you have a high risk of breast cancer in your family, then you're going to think twice about it. If your symptoms are incredibly severe,
Yes.
then you want to have the discussion with your doctor, because there are non-hormone treatments available for people who don't want to take HRT but have like crippling hot flushes, for instance. And there is things like vaginal estrogen, which is local, which doesn't have an increased risk of breast cancer. So you can tailor make to the individual. So it shouldn't be something that puts people off. I always say to people that if you look at the risk, the easiest way to look at it is if somebody who's got a normal BMI and takes HRT, there's less risk of somebody who's very overweight, who's not on HRT.
Yes.
So when you try and look at it that way, it's actually a risk that's worth taking for a lot of people. Now, there is a caveat on this, and that there's, evidence that will come out. So when people say to me, well, how long do I stay on it? And I say, well, it depends when you start and also what your symptoms are. You can relook at it every year and decide. Most people don't want to come off it, and that's fine. I think after 10 years, you take a good look. But in 10 years' time, all the evidence may have also changed.
Yes.
So in this kind of arena, we're having a lot of changes coming up. And there'll be more, hopefully more available medication that will suit people that maybe can't take the HRT.
That comes to conclude for the question I wanted to ask, that if I on board on HRT, does that mean I will have to be on HRT for the 12 years and more?
No, I mean, HRT, you take it for as long as you feel like you need it.
Yeah.
So, and regards to your doctor and what your needs are.
Yeah.
You do get protection for cardiovascular risk and your bones when you're on it. So, and that obviously gives you those many years that you're not going to be hormone deficient and then thinning bones, etc. So, it's like, for a lot of people, it seems very scary to take that first step. And like, how do I take that step? And then when do I think about coming off? Because that's the other question that, like you say, people want to know, when do I come off? So, the answer is, again, very individual. And some people say, well, I'm going to stay on it for life because I feel so good. Because once you come off it, those other symptoms then can return.
Resurface again.
And, you age as a woman, your collagen in your skin reduces, so do men, to be honest, but not to the extent that we do without our hormones.
Yes.
I always say a little bit like it's equating if you took testosterone off a man. Obviously it's not quite as true, ladies, so we won't do that. But, a man wouldn't stand for it. Yeah, us women seem to be happy to manage life without. In fact, just a little interesting story. I had a 77-year-old Kenyan lady, lovely lady, and her daughter came in and we were sitting there together, a consultation on something different.
Yes.
And I can't remember what it was. And she said, no, us women, this is a 77-year-old, us women, we have to take that pain and we have to take the hardship and stuff. And me and her daughter, who are similar ages, were like, are you being serious?
Yeah.
We have choice now, ladies.
Yes,
so,
we
and
do.
the choice is ours.
Yes.
So
we don't have to go through induced pain, that's self-induced actually, since there are other ways to ease in life. And that's the purpose of this podcast, of living an intentional life, having proper choices that should ease in and facilitate your life.
Yeah.
And I believe this is one of the conversations that we are having to demystify, to inspire and empower women when they are also having other important mandates to respond to in a long term. Thank you so much, Dr. Linda. Where can our listeners find you?
So I work at Columbia Africa in Lavington. We've got a couple of branches.
Yes.
But I'm in the Lavington branch and I'm there every day except for Wednesday morning, I have to have a breathing space.
Okay.
On the weekends, obviously, I'm not.
You're horse riding.
I'm horse riding. Well, I'm not. I'm with you, Alice.
Yes, I love that.
So, and exercising.
Yeah.
So
amazing. I would like to leave her contact, her landing page where you can read more about her practice and where you can find her so that you can go and book your consultation. Here we are girls who do things they say they will do. Go get yourself checked. Don't keep doubting yourself. Stop Googling, stop self-medicating, trying here and there, so that you can finally fix your hormone issues and embark on this journey with confidence. Thank you so much, Dr. Linda. I hope you enjoyed our conversation. Before we close, what is one thing you will tell women who live in the urban life about HRT? Invest in the knowledge. So go and do the reading. I usually give people a couple of reading signposting, if you like, to go and read. There's a website called Menopause Matters, and there's another one which is the Balance app you can actually download, and in that kind of arena there's a lot of incredibly good information. There's also books out there. There's one that's very popular called The New Menopause now. The New Menopause. Yeah. And it's scientifically based, which is really nice. Yeah. So just inform yourself, speak to your lovely friends about it, see what everybody else is doing. I'm not saying every woman should be on HRT. Mm-hmm. I'm saying go and get self-informed and self-aware, and you are able to drive things. If your symptoms are very bad and you come to me, I will probably say, go on HRT, try it. Yeah. You're going to have no harms for trying it for a month, for a year. I've never seen anyone come and say, I'm off this stuff. They're always like, give me more. Yeah. But that's for people who have very bad symptoms. If you have very mild symptoms, then you have a choice. Yes. The benefits are there though, and the more you read, the more you can make your own decision based on that. Thank you so much. It's a pleasure. I appreciate, and be blessed. Thank you. Thank you, Alice.